Welcome back. As weight loss drugs boom in popularity, here on the news at 7, we continue to follow the ups and downs of turning to those medications.
Everybody wants it. The demand is incredible. The need for medical use is incredible, actually.
You've probably noticed that surge in demand, even though some of these drugs got FDA approval as long as 20 years ago. But doctors say there's good reason for the craze right now because the medications work great for patients under the right conditions.
I think they have demonstrated robust weight loss, and it's truly helped patients who have suffered from obesity as a chronic disease, as a lifelong process, that through this intervention, they are seeing true changes in their mind of how they approach or think about food.
But as with any medication, it shouldn't be started lightly.
The first thing to consider is that this family of medicines are medicines. They're medicines just like any other. They're not magic. And then the corollary to that is that they do have side effects.
Now, these medical weight loss doctors from both Hartford Healthcare and Stanford Health say personalized plan. It's crucial, and it needs to be created with a medical professional. They say one danger is that some people are buying unregulated weight loss drugs online and aren't using them under supervision.
I think side effects that we are seeing coming across this medication is more related to gastrointestinal side effects, mostly, as mentioned, like diarrhea, constipation, reflux. And so I think when prescribing these medications, it's not only important to have a good overview of individuals' medical history, but a good amount of supervision and monitoring so we can appropriately work with the patient as they move forward with their process.
And then there's the way the weight comes off. Doctors say health should be the end goal, not that number on the scale. And since one effect is appetite suppression, losing weight too fast could be problematic.
In our program that's at the Center for Weight Management, we focus not just on the appetite suppression alone. We talk about healthy eating, not restrictive eating while on the medication, because what I think is happening now and is a concern for me is that it's being used just to have people eat less. That is not a durable or healthy way to lose weight.
And she adds that you don't want to lose muscle, so the medication should always be done along with healthy eating, including lots of healthy protein and exercise, including weight training. But along with losing weight, for some patients, the medications can really improve diabetes, high cholesterol, and even cardiovascular health.
I think it puts a different scope of lens on it, on the importance of this medication. And I'm hopeful that as we learn more of the cardiovascular health benefits that these medications have, there'll then be more insurance coverage with these medications.
But that brings up another issue. For the majority of Americans, insurance will not cover this class of drugs, and their price tags make them unaffordable to so many.
You know, our society has taught us for so long that weight is a failure of willpower. Increasingly, in the last few years, and with exposure of the science that regulates weight, we know that that's not the case. The exposure of these medications has also brought is an exposure of the health inequity, the access to health care that is really, unfortunately, the reality in our state and in our country.
If patients are not candidates for this medication, she says there are other ways to lose weight that go beyond simply eating less, exercising more. A good first step is determining a healthy weight that's informed by your overall health rather than just that number on the scale. And there are other weight loss medications outside of these drugs that can also aid the process. All of this starts with an open conversation with your doctor.